this very carefully, friends. Listen to this very carefully. Before the viruses enter into the body and produces abnormal symptoms, when the negative dynamic influence acts upon the vitality and deranges the vitality, as we have seen that when the vitality gets deranged, it creates a disturbance, and that disturbance will flow from center to periphery, affecting first our will and emotion, then our intellect, then the physical generalities are altered. So these are the three types of important symptoms that you initially observe in a patient even before the physical symptoms appear. Changes at mental level, changes at physical level. Understood? So when you take a person's case, out of all the symptoms that you get, one group of symptoms are those symptoms which comes or which are observed in the very beginning, in the initial period when the vitality gets deranged and the disturbance will flow from center to periphery. It has nothing to do with what kind of physical symptoms the patient will be having. Those changes, which is mostly seen at the mental level and physical level as a whole, belongs to the patient, not to the disease. Is it clear? Okay, I'll give an example. I'll give a simple example to understand. Do you remember the video clip that I have shown of my son, where we had discussed the rubric, look that cannot be a to be? Do you remember that rubric? There I had told that, if you remember, I had told that there are some group of symptoms that you will not find in him when he is healthy. But there are such a group of symptoms which you will find in him only when he is not healthy or not well. Like desire to be carried, irritability, violent anger, then look that cannot bear to be. So these symptoms you will not find in him when he is healthy. These symptoms you will find only in him when he is not well or about to be not well. So these are the early beginnings. This has nothing to do with whether he is going to end up having headache, whether he is going to end up having fever, whether he is going to end up having cold coryza, whether he is going to having stomach ache or diarrhea. It doesn't matter. These symptoms appear initially irrespective of what the physical symptoms would be. Getting this point? So basically this group of symptoms belongs to that particular patient. And in each and every case, there are certain such group of symptoms that belongs to the patient and will be seen irrespective of what his disease ultimately is or what physical symptoms he will be having, because these symptoms appear in the very beginning, in the initial phase. Getting my point? So those symptoms are called as the symptoms of the patient. Got this point? We all know that our human body is an automatically functioning system, right? Heart functions automatically, lungs functions automatically, liver functions automatically, brain functions automatically, the lymphatic actions functions automatically. Everything works in a coordination as a whole. It is an automated system, right? It has its own way of doing the things, including the digestive system and the other things, right? So there is a normal way in which each and every organ works and coordinates with the other organ, so that the human being overall gets a feeling of being healthy, isn't it? Now what happens when these pathogens, or let's say virus, enters into the body and it attacks the upper respiratory tract? What it does is that it tries to replicate, multiply and reproduce. They grow, replicate and multiply. So when they grow there, when they multiply there, when they reproduce there, they have some actions, right? Those actions basically interferes with the normal functioning of the body. So basically there is a conflict between the normal functioning of the body and the conflict created by the action of such invaded pathogens at that particular affected part. Is it clear? When these pathogens grow, multiply and reproduce within the body, it interferes with the normal functioning of that particular affected part, and there it produces some set of local symptoms. Those local symptoms which are produced, they can be explained how those symptoms are produced when we study the pathology. Like in cases of TB, how that patches are formed, how the patient will have consistent cough with a lot of mucus coming out. All these things can be explained when we study what exactly that bacteria do when it get into the lungs, isn't it? Basically those group of symptoms are a result of the action of those pathogens within our body.